The subject is very near and dear to my heart. I've had lots of friends and relatives who have been affected in some way by organ donation. And it really is the gift of life. We were hoping to have Stephanie Larson here today. She was one of our co-workers here at the hospital and still is, and she's busy working, so she's not able to be here. For several years, I was our hospital's liaison, or contact person with our hospital's liaison for LifeSource, and that person just happens to be our speaker today. I don't know anyone who is more dedicated to her profession. She's always been there for us whenever we needed her, jolly on the spot. And I'm very proud to be able to introduce to you Barb Nelson-Agnew.
Thank you, Lois. I feel like Lois and I don't know if I say we grew up together, but we worked together for a long time. So I'm Barb. I'm from Mahnomen, so not too far away from Wadena, about an hour and a half. And I've been with LifeSource, it'll be 20 years in January. And then I was with Red Cross Tissue Services. Red Cross used to have a tissue program where donated tissue was distributed throughout the United States. But they got out of that, and then I went to work for LifeSource. So LifeSource is based in Minneapolis. They used to be kind of an arm of the University of Minnesota back when transplants were first kind of getting up and running. The U of M was the first hospital in the United States to perform a human transplant. And pretty cutting edge, as you probably know. I know there are people in the Wadena community that had their transplants from the University of Minnesota, probably Stephanie, I think. And then there's another gentleman that was a speaker at your flag raising ceremony a few years ago that had a transplant at the U. So so we partner with them all the time because they're our largest transplant center. And then we also work with the Mayo Clinic in Rochester, another large transplant center that really is innovative and cutting edge. And I have some slides coming up here, just a couple that talk about some ways that we're actually, Steph, hey, come on up, Stephanie. So this is Steph Larson, and she is a heart recipient, and Lois was just talking about Steph, and Steph has worked here for a long time. Do you want to take the mic and tell us a little bit about your... Really? No? Yeah, just a little bit, yeah. Just tell us, how you've been touched by donation, and the whole hospital really has rallied around your story for a long time. Yeah. So sorry to put you on the spot.
I'm glad to come and tell my story. Always. It was good to see you. I'm Steph Larson, and yeah, I am a heart transplant recipient. It was in 2012 that happened. My heart donor name is Ben. I was fortunate enough to meet his parents about a year after, a couple years after, I suppose now, but leading up to everything in needing a transplant, I had a cardiac arrest and ended up with a heart pump for about a year, and was very fortunate to get my transplant about a year later. I'm on my meds that keep me going every day, and I go in for yearly checkups, and they're all really good, and yeah, that's about it. So very thankful for organ donors and to be here today. So yeah.
Very cool. Somebody that can walk the walk. Okay, so I'm going to kind of jump into my slides here, hoping that sometimes I apologize in advance. I have technical difficulties. When COVID started and we had to use Teams, I was one of the last people to really get the hang of it, so I'm still learning. Okay, so go back. It's not going to go back for me. But anyway, So this is our service area. We're one of, we have an acronym for everything at LifeSource. A lot of hospitals have acronyms for everything too, but we call ourselves an OPO, or an organ procurement organization, and there are 56 of them in the United States. So this is the ground that we cover. We have all of Minnesota, North Dakota, South Dakota, and 3 counties in western Wisconsin, and it's based on population, and we're certified by CMS and regulated by CMS, just like hospitals are. So we're considered a healthcare entity, and we have about 7 million people in our service area and 273 hospitals that we work with. So hospitals notify us every time they have a death or they have an individual that is on a ventilator that has a severe neurological injury or a non-survivable illness. So hospitals have been required to call us. That's how we find out about potential candidates for donation. Maybe, I don't know if you ever wondered how we find out, but that they're required to call us. And the gold standard, and it's not even our standard, but Joint Commission and CMS has a gold standard of calling us within an hour. So we track all of that, and then we provide that back. And Lois used to be my go-to for giving her that data, and then the hospital in turn has some compliance measures, because CMS has expectations for us as an OPO, but they have expectations for hospitals too. So they want to know how the hospital is doing. They want to help end deaths on the waiting list just like we do, because it's really kind of an epidemic. There's over 100,000 people that are waiting for a life-saving transplant, and another person gets added to that list every 10 minutes. And 23 people will go off the list today because they won't get their transplant in time. So it's a crisis. And so the government really has their hand in a good way, as a watchdog to make sure that we're dotting our I's and crossing our T's and doing everything we can to make donation happen. So we have 9 transplant centers in our service area. I talked about the U and I talked about Mayo. And we try to place with those transplant centers first, and then we go out from there. I'm having trouble advancing my slides. I don't know it seems like it's locked. Oh, maybe I need to do this. Okay, got it. So, sorry. I told you, I warned you. So this is our building. It's probably 6 years old now. It's right along the Mississippi River, and the cool thing about it is it houses our metro team. So as you can imagine, the bulk of our organ donors are from Minneapolis, St. Paul, because that's where the big hospitals are, like Regions and the U of M and Hennepin County and North Memorial. So we're based in Minneapolis because that's where the largest part of our volume is. But we also have 2 operating rooms that I think I have a picture of coming up. And we transfer a lot of our tissue and eye donors to Minneapolis now. Instead of our teams flying out to hospitals, flying to Wadena, flying to Williston, North Dakota. Williston isn't a very good example because most of the time we're going to fly there just because they're 8 hours from anywhere. But so we started doing this before COVID, and we were really glad that we did start transferring, because there's a huge pilot shortage right now. We have transportation issues getting our teams where they need to be, like Bismarck, North Dakota. Sometimes we have issues with travel, and that can impact donation too. Sometimes when we have a heart placed with the U and there's a winter storm and the pilots can't, get a flight out, we might have to go back to the list and reallocate sometimes depending on what's going on. So weather plays a really big deal. But I'll talk about this OR in a second. I should put my glasses on. We were talking about hot flashes earlier out in the hall, and this is another thing. Reading glasses, come on, they're so annoying. So the need, I talked about, there's over 100,000 people. This is Sally. She's been to Wadena before. Lois has met her. Maybe some of you met her. She was big into the Trails for Transplants, and they're huge into public awareness and public education. They donated money for your Garden of Hope here in Wadena. Anyway, her liver is 101 years old now. We celebrated her liver's 100th birthday last April. It was 82 when she got it, and she has a birthday for it every year, April 23rd, and so it's still going strong. Her husband died a few months back, and she always thought that they both thought that she'd be the first to go. But she's doing really well, and she received her transplant at Mayo. So it does a lot of public awareness. So a little bit of facts. If you think you're too old to donate, hey, Sally's liver donor was 82. Don't rule yourself out. We have a lot of surgeons that are doing what they call extended criteria donors, which is a politically correct way of saying over 65. We have a lot of them. We have something we're doing BTD donors. These are kidneys that we recover. They're not perfect, but BTD means better than dialysis. So if you have patients that are going to dialysis 3 days a week, they might be willing to accept that non-perfect kidney that will extend their life. And so you have lots of surgeons that are accepting those now. We've been doing that for about 2 years. It doesn't cost donor families anything for their loved one to be a donor. We don't pay funeral home expenses, but we do pay for the transfer that I was talking about earlier. We pay for everything in the hospital leading up to the donation event. So that's a question that we get asked sometimes. Don't try to think about, well, am I a potential candidate or am I not? Because we change our criteria based on the demands in our country for organs and tissues, and so leave it up to us to determine eligibility. And then what we tell hospitals is just call everything. It's actually calling everything. The requirement is 36 weeks all the way up is to call us, and the gold standard is within an hour. So we field about 100 phone calls a day, between 85 and 100 from our 273 hospitals. I talked about this just now. So, about 29,000 phone calls. What percentage of those phone calls do you think anybody are eligible organ donors that we actually evaluate? It's low. Anybody got a number? Lower. Lower than 5. 1%. So a person, that's a big reason why there's so many people that are waiting, is a person really needs to meet special criteria in order to be an organ donor. The big one is they need to be on a ventilator because the organs have to be perfused, because if they're not oxygenated, they're not suitable for transplant. And a lot of people just don't die that way. So that's a big reason why there's so many people waiting. But only 1%, and then only 3% are eligible tissue and eye donors. So tissue and eye is a little bit different than organ donation. Organ donors have to be on a ventilator, and tissue and eye donors don't have to be on a ventilator. We actually have up to 24 hours to recover tissue and eye. And I have a slide about Astera Health's donation activity. And this is what I call a tissue and eye, mostly a tissue and eye exclusive. We'll get the rare vented referral from Astera Health, but most of the time those patients are going to be transferred to a higher level of care like St. Cloud Hospital. Most of the time they don't maintain patients on ventilators here for a long period of time. And there's nothing wrong with that. That's how most hospitals operate, this size anyway. But tissue and eye is another story. And we'll get into that in a second. So somebody can donate their lungs, their heart, their kidneys, their intestine. Intestine is rare. We've only done one intestine transplant all this year. Most of the time when we recover intestines, it's for research. Most of the time an intestine transplant is a very, very last resort for somebody who has intestinal issues, like my son's got ulcerative colitis. And his physician has said, we'll remove part of his intestine maybe at some point, but intestine transplant is not the way to go for the best outcome for him. So he's on a biologic drug. And then the pancreas and the liver. So extended criteria donors that I was talking about earlier, over the age of 65, we do lots of kidneys and lots of liver. extended criteria. The liver actually can be split and go to 2 different people because it'll regenerate again. And then we have all of these gifts that are in orange. These are considered tissue. So we recover veins. Those are used in heart bypass surgeries. Or if somebody has bad circulation in their legs, they might replace those bad veins with donated ones. Tendons, sport and trauma injuries, a lot of times those are donated tendons being used in those procedures. Skin is used for breast reconstruction post-mastectomy. When a woman has had breast cancer and is having restorative reconstructive surgery. It's used for that, and then it's used for wound care surgeries too. We used to say it was used for burn victims. Most of the time now that's synthetic skin that they're using for burn victims. Bone marrow, we have a surgeon at the U of M who recovers bone marrow on his organ donors, his kidney donors actually, because he knows that his recipients have a better outcome when the donor bone marrow is transplanted with the kidney. We have corneas and sclera tissue, that's Lion's Gift of Sight. That recovers those tissues here in Wadena. And what happens when we have a transfer, like I was telling you about, to Minneapolis, Lion's Gift of Sight is based in Minneapolis too. So we work really closely with them, and they come right over to our building that I showed you earlier, and they do the eye surgery at our building. Heart valves are life-saving. They go to 2 different people. The aortic and pulmonic valves are separated. I know this is a lot of information I'm throwing at you, so let me pause for a second and see if anybody has any questions about what I'm talking about so far. Nope, I'm going to keep going. So, organ, patient has to be what? Have to be on a ventilator, right. Tissue and eye, they can not have ever been on a ventilator, and we have 24 hours to recover tissue and eye. The FDA, we're highly regulated by the FDA, and they have something called good tissue practices, and we get evaluated by them every so often. They come on site and they evaluate us. Very few medical rule-outs for organ donation. Like I said, don't rule yourself out. Let us figure that out. Our oldest kidney donor was 92. We also do some extended criteria tissue and eye. Sometimes we recover skin from patients that are 85 years old. And so things have really changed since I started in this role, just drastically. The nurse is key because the nurse who's taking care of that patient and their family is usually the person who calls us. And that person has a lot on their plate. They're dealing with someone who just lost their loved one, and then they're still expected to call us within an hour. Some hospitals have special house supervisors or charge nurses that come in and they make the call while the nurse is working with the family. So it kind of depends on the hospital. Most of the time it's the bedside nurse that calls us. We ask a whole bunch of questions. One cool thing is we have remote access to charts. So we're exempt from HIPAA. So if you're wondering, how do you get away with finding out all this information about my loved one? We're exempt from HIPAA, and that's because we're trying to end deaths on the waiting list. We're trying to save lives through transplant. So that's why. So we can go in, and this saves the nurse a lot of time, and it saves us a lot of time because we can go into that chart. We can look, we have an algorithm that we go through to rule in or rule out a candidate. So we can go in and we can look at some information and determine eligibility. But the nurse is essential because they call us, number one. We're asking them some questions about family dynamics. We ask that the funeral home not be called. We're not trying to hide anything from the funeral home, but we're trying to evaluate for donations. So if the funeral home shows up and we're evaluating, that could be a dicey situation, especially if they're coming from somewhere, maybe they're coming from Park Rapids or something, and we're saying, no, donation is pending. They're probably gonna have to turn around. So call us first, we say, and then we evaluate, and then we communicate with the funeral home about what the plan is if donation is gonna move forward. We work with the transferring funeral director service to transfer the donor to Minneapolis, and then when the surgery's done, we bring the donor back to the family's chosen funeral home at no cost to them. So we've really kind of eliminated going into hospitals for the most part when we do tissue surgeries. Organ recoveries, I'm going to talk about that because we have a brand new thing that we've been doing. Well, it's been about a year now, but I never would have, who would have thunk it? But we're doing it now, and I'll talk about that. Okay. Medical examiner cases are not rule-outs for us. We need permission from them, though, because they could be called to testify in court. Maybe it was a homicide. We get restrictions from them because they have jurisdiction over the decedent. And so we call them, and here you work with Midwest Medical, not you, your hospital works with Midwest Medical Examiner's Office in Anoka. So we get a timeline from them, they tell us what we can recover. Maybe it was a gunshot wound to the head. This might be more information than you ever wanted to know. But they might restrict parts of donation if they need something, that they might be called to testify. They ask us to take pictures a lot. And we bring digital cameras with us and take pictures of things that they want us to pay close attention to. So this is my big news. And you might know about it already, I don't know. We have 2 donor care units now. We transfer organ donors from the originating hospital. Within a 100-mile radius, we're transferring them to the University of Minnesota. And outside a 100-mile radius, they're transferred to Mayo. Mayo's one flight team actually comes on site to the hospital. So if we ever had a patient on a ventilator here that met the criteria for organ donation, Mayo's one flight would come here and pick up the donor, bring them to Rochester, do all of the donor care, all of the tests, all of the allocation or the placement of the organs, all the way through the operating room. Mayo's Transplant Center has a program for families if they want to come to Rochester and be with their loved one. Donation doesn't happen, Johnny, on the spot. It takes a couple of days, a couple of solid days, sometimes 3, from start to finish. And allocation or the placement of the organs is the longest. Has anybody been involved in it before with LifeSource? Yep. At the U. I remember. Yep. Yeah. Yeah. Yep. I just remember him he was speaking here, not here, at the other, during a flag raising. Yep. So anyway, they offer a program for families. They pay mileage. They pay for food and hotel so that their loved one can be with their donor loved, or their family can be with the donor while they're going through this process, which is really kind of neat, I think. And we've had quite an increase in organs transplanted. I think that's on my next slide. So since October 5th, 2023 is when we started it. We're kind of late to the party. Of 56 organ procurement organizations, 24 of them already have donor care units, either within their own building, like our building, we're not set up for it, or within a hospital partnership. So we started doing it to increase donation, and we've had a 36% increase in lung recovery since last year, and a 23% increase in heart transplants directly attributed to our donor care units. So these people in the donor care units, we're not saying that hospitals don't do a beautiful job of supporting our families and our donor patients, but these people are specially trained. They're taking care of the donor, and that's it. There aren't other patient, in hospitals we have other patients that nurses are taking care of in addition to our patient. So these people can get bronchoscopies done immediately when we're evaluating lungs, or angios and caths done when we're evaluating the heart. We can get labs done right away. We can get to the operating room quicker, and we can transplant more organs. So that's why we started doing it. And we've seen some really good success.
Is the patient on the ventilator till they get to you?
They're on the ventilator the whole time. When they're transferred there, that's why we have the Mayo's one flight team is, they specialize in transferring critically injured patients. So that's a good question. Yep, they stay on the ventilator the entire time.
So backing up a second.
Yeah,
1%, so 1 transplant in every 100 people, right?
yeah,
So, for instance, she wasn't notified until
Right. Well, her surgeon probably evaluated it and probably talked to Steph about, you can,
Yeah, they let me know that there was a heart available, but, until I was back probably in the OR myself, and he was there with the donor, seeing that heart, he wouldn't know until, then for finally that would be a heart that would be okay to, match for me, 100%, so. I mean, there's criteria, there, yeah, so, yeah, so.
takes so long.
Yeah.
Yeah.
So I could go on a dry run, and go all the way down there and something not work out and I would be sent back home again. But I was very fortunate, everything worked the first time, so.
Yeah.
When those donors are not, they're not able to use those organs, they're just kind of put back together and sent to the funeral.
They either, it's at the family's request, if they want us to put the organs back with their loved one, we will. Otherwise, they're respectfully discarded.
Okay.
Sometimes we'll go, so we'll have a heart placed. We do PYs, we call them provisional yeses. So if number one falls through, we go to number two and say, hey, number one doesn't want it. Do you want it? So we'll try to do, we're like rallying around, because it's so rare. We're really trying to place that organ. So if number one falls through, maybe number two will accept. So, and it's very subjective. Transplant surgeons are, yeah, that's not going to work for me. Because they have one shot too, so they want to make sure that they feel confident that this is going to be a match for the recipient. Yeah.
I'll ask you, Steph, did you know that you were number one on the list?
I never asked that question, I guess.
So people jockey up and down the list based on their size, their blood type. They have to be a match. How long have they been waiting on the list? Their geographic location. Because the heart, we have 4 to 6 hours to transplant it. Once we get it out in surgery, it's got to be transplanted within 4 to 6 hours. So typically we're transplanting in our service area or close to it, like Iowa Donor Network or Wisconsin. That's a good question.
You were here and you had to go to the cities?
Yeah, we live in Wadena, and there was discussion on timeline, whether or not I would have to be flown down or if I could drive. And, like she said, it takes a while for everything to fall into place, so I was able to drive down with my husband and my mom down to the cities. And then the next morning was my surgery that I went into, so, yeah, we had time for sure.
It's kind of a miracle that it even happens because there's a lot of ducks that need to be in a row before it happens. So this is a picture of one of our surgery rooms. We have two. We're taking the donor, like I said before, this is for tissue and eye donation now. We're not tying up the OR anymore. If you have a little hospital, say CHI Lakewood Health in Baudette, they have one OR suite. So sometimes when we come, we try to come. Sometimes nurses, have said to us, what are you doing? You seem like you don't have your crap together. You're coming in the middle of the night. And it's like, we do that on purpose so that we're not messing with the OR schedule, because that can be really upsetting to a surgeon who's doing, colonoscopies or whatever, and we're bumping people off the surgery schedule because we're tying up the OR for 6 hours. Because the tissue and eye recovery takes probably 4 to 6 hours, depending on what we recover. Organ surgery takes about the same for the donor, depending on what we're recovering. So anyway, we're not tying up that OR anymore. They don't need to clean it when we're finished. Go ahead.
How long was your surgery?
I guess I never put a timeline on it. It was an all-day affair. I don't know. It was about 7 in the morning or so that I probably went back, but then, from there, I have no idea. I guess I never really asked that. And then I had complications afterwards too, so I woke up 10 days later. So, yeah.
Wow.
I guess I never, sometimes questions unanswered are okay. So, yeah.
How much time do I have?
We just have to be out of here by 1.
So this is a big deal. We call it FPA, or First Person Authorization. When somebody has it on their driver's license, they better mean it, because we mean it. And in Minnesota, it's called the Darlene Luther Act. It's as powerful as your will. Can't be overturned by anybody. So even your loved ones, if somebody's registered as a donor and their loved ones are saying, wait a minute, I don't think they meant this tissue and eye business. I think they meant organ donation or whatever. We try to get to the bottom of what their objections are about. Maybe it's timing, maybe it's what they're gonna look like. But when somebody's registered, they've already given us permission to proceed with everything that they're eligible for, organs, tissues, and eyes. So I was just looking at another hospital's data this morning, as they have me send it to them every month, and they had 6 tissue donors. All 6 had FPA. So all 6 were registered. So what does that tell me? What does that tell you, anybody? When somebody's registered, most of the time, their wishes are going to be honored, because we make every effort to honor them, okay? So we try to get as many people as we can to register, because we know that it takes a lot of relief off a family when they know that their loved one is registered as a donor. That's one less decision they need to make. And most of the time, families do not want to go against what their loved one decided to do. So it's easy to do. It's on the front of your card. You can go online and register. It doesn't cost you anything. It's called donatelifemin.org if you're not registered already. Or the next time you go into the DMV, you have to do it every time. So every 4 years, you got to register again. You check the box, and then your wishes are going to be honored. Tell your family what you've done. When we run into conflicts, most of the time it's because they weren't aware that the loved one was registered. But it is a really big deal. So Wadena County right now, 59% of license holders are registered donors. We know that number could be a lot higher. There's 2 guys in the room, and I have something to tell you. My last slide, we have a campaign this year, and it's all about men, and I'll tell you why in a few minutes. So this matters, because when somebody registers, they've given us permission. Most of the time, we're going to move forward. Nationally, we're at about 50% of license holders are registered, and in Minnesota, you can put it on your state ID card too. Maybe somebody doesn't have a driver's license, but if they have a state ID, they can register. We have 2 tribes in our service area that I'm just really proud of. In North Dakota, Turtle Mountain Band of Ojibwe was the first tribe in the United States to enable their tribal members to mark donor on their tribal IDs. And they did that 2 years ago, and they've had like 560 people register in 2 years. It's tough to get a license sometimes. Sometimes DMVs aren't open. Sometimes they're open at weird times. Sometimes they're really far away. This is just another way that people can document intent. And then in 2024, the MHA Nation, kind of in Newtown, North Dakota, they copied what Turtle Mountain did and did the same thing. So we're seeing some momentum with our tribal nations in our service area too, where historically rates of FPA are much lower. And sometimes we attribute it to a cultural thing. Sometimes, most of the time, it's just a lack of awareness. So those are areas that we really try to work on too. So this is a map of our 3 states, and you can kind of see who are the people that are registering the most. So people between the ages of 25 and 34, 66% of them are registered donors. 60% of people 18 to 24 are registered. So in Wadena County now, so we have a state law that's kind of cool in Minnesota. Every public driver's ed class is required to have 30 minutes of instruction about what it means to be an organ, tissue, and eye donor, because those kids are going into the DMV, they're getting their licenses. What does that mean? And we've seen some real success with that. A lot of times we have ambassadors that are going in and telling their stories to driver's ed classes. Is there a question?
How many over 65%?
Let's see. So I got to put my glasses on. 55%, no, 51% of people 65 to 74, so it goes down. People think, I'm too old, nobody's gonna want my, that's kind of what the feeling is. Or they think, oh, that newfangled organ donation, I don't want to do that, Organ donation, it's been around for about 50 years, maybe 50 or 60 years. So in the whole big scheme of things, it's relatively new, I guess, but it works, right? Okay. So you can see these orange counties, they have lower rates of FPA. I live in one, actually. Monoman's got really low rates of FPA. Despite having all the materials in the DMV and doing driver's ed and whatnot. But so where there are tribal nations, we're honing in on them, especially this year, to try to increase those rates. Aftercare is a big deal. We have 2 full-time donor family aftercare people that follow all of our donor families. We have events. We just had our event in Fargo last month. We had 2 in Minneapolis last month. We have a private Facebook page for donor family members. They all get a letter talking about where their loved ones' gifts have gone and what they'll be used for. This is my boss right here. Her dad was a donor, and her little daughter at one of our donor family events at our building I showed you earlier. So we're really proud of the way we support our families after the donation. So rest assured that at Astera Health, when we have a donor family, they're one of us now, and we follow them for as long as they want us to. Sometimes they don't want anything to do with us, but most of the time they do. So, 20 tissue donors from Astera Health in the past 10 years. That's a lot of people when you consider over 150 people can benefit from one tissue donor because of all of the grafts that can be recovered and help transplant recipients in surgeries. 3,000 people, that's a lot. 14 of those 20 had FPA, or first person authorization. They had it on their license or in their healthcare directive. 281 referral calls to 1-800-24-SHARE, which is a line that we own that hospitals call every time a patient dies in a hospital. So we really appreciate the partnership that we have here. Okay, now, I might have technical difficulty with this. I'm just going to tell you in advance. So men, our message to men is get your butts into the DMV and register. Because you say you think it's a good thing, but do you? Because you don't take that extra step and register. 50% of men surveyed had not registered to be a donor. We did a survey in 2023. 62% of people waiting for a transplant are men. 60% of unregistered men surveyed said they definitely supported donation. So what's the hiccup? So men need more convincing. Also, women make 80% of the healthcare decisions, so that could be part of the problem too.